I'm Ryan Carlson. I'm here with Nicole Boskoski from Elaborate, and she is the Chief Executive Officer. So thank you for coming here to talk about health data and what you do.
Yeah, absolutely, Ryan. Thanks for having me.
So my first question is, what market do you serve and what pain is it that you're solving within healthcare?
Yes. So before answering that question dryly, I'll ask you, when was the last time that you went to your doctor's office and got some blood?
3 weeks ago, as a matter of fact.
No way. And
Yes
tell me,
way.
how did you get the results back? Did you get a scary looking PDF?
I got an email
Okay.
to a portal to a form that I couldn't really decipher.
Oh, good, good. So that's like actually 3 more steps on top of the normal terrible experience someone has of getting the scary looking PDF you have no idea what to do with. And
Yeah.
so you end up calling your friends and your family and messaging your doctor after WebMDing that you have cancer or some sort of crazy
Right.
diagnosis.
Yeah.
So that's the problem that we're solving. So Elaborate is a health data delivery platform that helps doctors to deliver lab results to patients that they understand. And importantly, the value proposition is not to just the patients who are experiencing a much better experience understanding what their data means, but more importantly, we're helping our doctor partnering clients to eliminate all of that unnecessary admin work that's happening between doctors and patients when they try to go back and forth ping-ponging this information and
Yeah.
trying to solve asynchronously the problem of poorly communicated data.
This is a story that I've heard more than once when together with friends, where, whether it was life insurance they applied for and then they get the thing and it's always out of context.
Yeah.
And when you said go to WebMD, I've heard this
Yeah, that
no fewer
resonates.
than
I
3
know,
times,
I
right?
know, I
I'm
know.
feeling my skin crawling. So tell me, what is it that you're uniquely doing to solve that challenge to make the data speak like a person?
Yeah, absolutely. And what's funny is when we started the company, there's lots of ideas and we knew that there was something around the space to really dig our hands into after spending the last 10 years in very fast growing digital health organizations. So we knew there was a problem, but we didn't really know what the problem was. And as we started talking to more and more clients, more and more patients, we heard the same story over and over again. I WebMD, I had no idea what was going on. I thought I was dying. I called my doctor in a panic. It was Friday afternoon. I couldn't get help. That exists among this spectrum in so many different stories, some of them being much more serious of, a child who has some sort of really concerning critical value who isn't getting the care that they need because it wasn't delivered properly, to the more annoying, cumbersome experience that you've described. So the way that Elaborate works is we are B2B2C business. We partner with doctors. So doctors are our clients, but the doctors don't actually have to change any of their workflows or any of their operations. So it's kind of a dream scenario product for them. We hook into the EMR through our amazing partner, Health Jump. We hook into the EMR and the doctor, just as always, will see you for your, annual physical or your sick visit. They'll order you blood work. They'll send you to go get your blood work at whatever location you're already sending you to.
Yep.
But when we get the data back, we have an underlying clinical algorithm that was built by doctors in-house, designed around evidence-based medicine and the standards of care within primary care.
Yep.
And we surface to the patient, what's the so what? So rather than the first view being each of the different data points that tell you what does this mean? It actually doesn't matter to you what an RDW is and whether or not it's abnormal. It matters within the context of the bigger picture. So we look at all of those different data points. We summarize for you as a patient, what's the key takeaway?
Mm-hmm.
Are you fine? If you're not fine, what should you do about it? And in most cases, in that case of what should you do about it, that's a custom white labeled solution that's developed with our clients to say, we want your patients who need to talk to the doctor to come back and talk to you as the doctor. But there's also other elements things that they can do, whether it be talk to a nutritionist, take the supplement, whatever. The important part is we don't diagnose. We just provide that sort of translation layer between doctors and patients so doctors can focus on what they do best, which is talking to patients who need the help and support, not calling patients on voicemail. So that's the real difference, is that sort of, contextualization. And I promise I'll get to a point here, when I think about the partnership with Health Jump, what's really interesting is, our ability to not just pull the one-time results, but actually to pull the entire health history of that patient and look at all of their past records. What are their diagnoses codes? What are the patient notes saying? And we use that data to then inform what we surface to the patient. And without you guys, it wouldn't happen.
So what did that for early journey look like? Knowing that getting historical data is really hard.
Yeah.
What roadblocks were you running into when you had this aha moment?
Yeah.
You wanted to, make language slap, speak like a person, have this lab results mean something to consumers like you and I.
Yeah.
And what did that technical journey look like as a startup?
Yeah. So I'd say for anyone considering one day starting their own business, especially within the provider space, the number one challenge that you will be told is a challenge, and it is a challenge, is the integration piece. What you want to do is make it seamless for a practitioner to use your product. And to do that, you need to be within the EMR. There's no going around it. All the solutions that attempt to sit alongside, it's just too difficult to engage in their workflows because they're already burned out. They can't do one more thing on top of their daily, task list. So when we think about the early journey and the early challenge, we knew from day one we wanted to be integrated with the EMR. And that can take a number of different applications. You can work with a cloud-based solution that's API driven. You can work with one that's, you're more accessing the front end and then using screen scraping. But all of these different techniques of integration required your own essentially rinse, repeat, relearning of how do you get this data. Not just how do you get it, but how do you get it in a way that is easy to parse through and programmatically that is accurate and correct on behalf of your patients that you're sending it to. And so we tried to build a few of those solutions on our own and came to very quickly realize that we would need a team of at least 4 or 5 engineers full-time dedicated to this effort. And we could do that. But as a small business where we knew our core focus was around this insights layer, and that's really our core IP and our product mode, we knew that that was an opportunity for us to outsource to someone who was building this as their product mode and partnership. So that's where we built a partnership. And then on our side, it allowed us to unlock all of our time and resources to focus on this underlying algorithm that is machine learning based, but also is, again, like built off of the insights that our doctor team has pulled together and provided, that then allows us to come to our clients and say, we have something that we think is probably pretty close to what you're doing already. You can customize it, but we've built this with years and years of information under our belts and also all of this historical data feeding into it.
So you're getting both historical data so you can look at it over time. So each case, it's not just a snapshot of trying to make guesses based off of one lab result, but historically they've had high blood pressure or high cholesterol or any of these things, right? So your algorithm is tailoring that piece. And then it's the lab results come in through the normal, conduit, right? That every EMR has.
Yep.
And then you interpret that data and then contact the patient, right?
Correct.
Based off of the demographics information. So then they receive electronically, here's the normalized human language around what your lab
So
was.
what? Yeah.
And then the provider hasn't had to change anything on their end since
Not at all.
you're not living in the EMR. It's not a little,
Not a button.
it's not a button. It just happens. So are they being looped into that communication? Tell me, like, how does the doctor know what their patient saw?
Yeah, great question. We're pushing back either a note or PDF, depending on the doctor's application and their preferred workflow. And that's coming right back into their EMR so they can see it as an encounter note. And it says, here's what Elaborate told your patient. Here's what we told them to do next, whether it be talk to you or, hey, you're fine. And then that's a really great opportunity for us to constantly get feedback from the doctor. And, hey, this is a patient I actually shouldn't have seen. This is a patient who instead should have seen my mid-level. Here's a patient who should have done this other thing. So we're constantly getting that feedback loops from our clients, and not only creating a more proprietary algorithm for ourselves in the process, but we're customizing it to their specific specifications. So it's really unique. And what's really cool about having this historical record is, as a patient, I'm sure many of you out there have the same experience. I have always, on every single lab report I've ever gotten since I was a kid, I've always been low in certain markers. I just ride low, as they say. But every single time I would get these reports, I forgot that I rode low in those markers. And so I'd freak out and think, oh no, like the world is dying. My white blood cell count is low. I am going to be exposed to COVID. And because now you have an interface that tells you, hey, you've actually always ridden low, it's not a big deal. It creates that reassurance for you and that trust that this product knows you and knows what it is to mean healthy for you.
Yeah. So I know that blood work has been having a lot of innovation as well, like being able to understand people's fitness profiles, their dietary profiles. How is that factoring into this evolution of your algorithm?
It's a great question. So I think when you think about the broader space, people are interested in understanding themselves and their health data. There's no question about it. That was way before, all of the Cures Act stuff went into place last April. People want to understand themselves, and whether that be Fitbit, Levels, whatever you use, you want Whoop is a big one. You want to understand how am I doing on a day-to-day basis. Elaborate's a little different. We're not giving you that day-to-day basis unless you're getting daily blood work, which I hope no one out here has to do.
Yeah.
We're not giving you that. What we're giving you is the gold standard of are your body's systems performing to their optimal level?
Okay.
There's roughly like 10 to 12 of them. Are your body systems performing to their optimal levels? And roughly for a normal person, you're getting blood work 1 to 2 times a year. So this is the gauge that you can use to pressure test whether or not all those other tools are actually helping you to succeed. And so in the future, what you might imagine is that we partner with some of those more daily applications
Yep.
to say, hey, Ryan, it actually seems like your cholesterol is trending up over time. I'm not going to be the right person to actually tell you
Right.
what to do. You've talked to your doctor 6 times about this. We need to get you more support. Here's a partner that we know based on thousands of patient records, having gone through it. Here's a partner we know helps people turn the clock on cholesterol. I'm going to enroll you in their program and I'm going to give you a discount. And suddenly you have a really highly curated recommendation of what to do and what to do next based on the gold standard of health data, which is blood work.
That's awesome.
It is pretty awesome.
So
We like to think so.
I know. I'd say I love nerding out on some of these, the new, like this idea of a gold standard of blood work. It's something that I think is fascinating, that you're digitizing our understanding of blood work and then applying it to human language. Are you using any, like, is it a natural language processing, or how is it that you're taking a bunch of medical terminology and making it into something that regular people would understand?
Yeah.
Right?
Yeah. So we have a number of AI applications within our product. And for those out there who are curious, like AI at the end of the day, it feels really scary coming into it. And you think, oh my gosh, what does this mean? It's this crazy thing. Only 2% of the world's population understands, who are all engineers. AI ultimately just means training machines to do things that are relatively repetitive and, have a clear enough framework of what the machine should do if X, then Y. So we do have a number of applications within our product of AI. We do use an NLP, a natural language processor, through OpenAI, which is the gold standard of this sort of technology. Critically, I'd say though, like the NLP, what it's good at is making things simple. I don't think it's excellent at making things conversational and clear and really elevating it to the level of like tone and voice that what you're describing.
Yeah.
So we actually have a team of clinically trained content writers who we've built. And this is people who are residents, medical students across the country in the best institutions, the Hopkins and Dukes of the world.
And so they're training your model.
And they are training our models. So we're having them partner with our engineering team. And over time, we say, okay, hey, here's how we want it to be communicated. Let's do that for 100 of our insights, these like surfacing layers that we're talking through. Let's do that. And then over time, you use that data to then train your NLP and refine it. So you can use something like the Da Vinci algorithm for OpenAI that helps you simplify stuff, but then you need that like little bit of elaborate ML on top of it.
Cool.
Yeah.
Last question.
Yes.
What is Health Jump to you?
My best friend. I'm not even kidding. I have no idea where we would be without you guys, because getting the data is a total nightmare. So I think for us, we are focused fairly specifically within serving the provider segment of, mid-market SMB providers who are looking to optimize their administrative time towards billable time and create a better patient experience in the process. For those guys, they use 45 different EMRs. They use Chrono, Athena, amazing charts. They're all over the place. And so for us to have to, again, like create that functionality to integrate with each of them, it would require us either raising a hell of a lot more funding or just picking one EMR and just focusing on that segment. And what's really interesting is because of our partnership with HealthJump, we have been able to be a little bit more relaxed with our sales qualification criteria, and we can service more clients and really be selective in serving the best clients who we know see the most benefit from Elaborate.
Wait.
It's the truth, honestly.
So we only got a couple of like half a minute left. Just talk to me about the time it takes to get a customer up and running.
Yeah. So we've built our own internal onboarding process where we can get a new client from 0 to 60 within 30 days. So from the contract signing process, during the contract, they're also signing the BAA with HealthJump because we are obviously HIPAA compliant. We have BAAs between us and the party, as well as between the party and you guys as Health Jump. So from 30 days from signing that contract, we are getting reports out to the patient, saving you time, saving you headache, and creating actually more revenue for you as a business, anywhere from 3 to 5% increase in top line. So within that 30-day time horizon, what we're largely doing is hooking up the integration with Health Jump, actually partnering with the practice to create that new workflow, because oftentimes it requires retraining the team to not have to do work, which they're like, this is weird. I don't understand. I can go home and eat dinner with my family at 6. I'm used to doing, pajama time on my laptop. So that's really like the biggest two pieces of that 30-day onboarding, but it's fairly simple because it's software, and software is very scalable once you customize it to the client's needs.
Thank you.
Thank you.
All right. Enjoy your hymns.